According to Liberia's Poverty Reduction Strategy, compiled in 2008, less than 15% of Liberians have access to human waste collection and disposal facilities. The result of this fact can be seen around the country. And due to a mass shortage of sanitation facilities, such as toilets and latrines, many people are left with no choice but to defecate openly, even around their own communities. Built in 1970, this sewage plant used to treat 6 million gallons of waste each year. Today, the system is inoperable, filled with backed-up sludge and raw sewage. But the plan is to rehabilitate it, and also to clear out the surrounding area.
As you get closer to the sewage network, raw sewage, you may have some epidemic, cholera, waterborne diseases, and what have you. So the people encroach, so there's a need also to remove these people from the place, not to get them closer to the hazards of the sewage.
At Monrovia's new Waynetown landfill, there are similar concerns about the health and safety of nearby communities. With levels of poverty high in Liberia, some people have even taken to picking through the waste, looking for any items they can use or sell. And although the new dump areas are being carefully lined, project planners still have to be cautious to avoid polluting the local groundwater. Staff at the Claratown Health Clinic know all too well the dangers of drinking contaminated water, which they say is found throughout their own community.
Well, the health of the community is not too good in the line of the water problem, because as you see around the community, they are using underground water, so it causes more diarrhea cases.
Diarrhea is a chronic problem throughout Liberia, where, according to the World Health Organization, 18% of all deaths are caused by lack of safe drinking water and bad hygiene practices. Although Claratown Health Clinic looks after patients for free, not all clinics do, and for many Liberians, treatment is an expensive luxury. Located only a few minutes' drive from Claratown Clinic is the community of Bilima, an area that has recently undergone some major developments. Through the intervention of Liberia Wash Consortium member Concern Worldwide, Bilima recently welcomed a series of new wash facilities, including 2 sets of latrines. Concern also helped community members to develop a long-term maintenance scheme, charging small amounts for the use of the facilities in order to ensure their upkeep.
This is one of the facilities that we build in the community for Bilima community. The community is overpopulated, and so more than 300 persons can use this per day.
It's very important because there was a time we never had toilets here. People go about, they use plastic. They use the plastic as latrine and chunk it around. When you ask them, what you do, they say that grenade, they are throwing grenade. That's the thing they have for it. They say they train grenade. They go anywhere in toilet. But now from the time concern came about, they came to help us, they implemented what they promised us. So we are grateful to them.
Another area benefiting from Liberia Wash Consortium intervention is Maryland County. Here, Solidarity International has been working with local health clinics to clean up the disposal of medical waste. Like others in the area, Bonnigan Clinic used to dump its used syringes and needles into an open pit. But thanks to training by Solidarity, health workers here now understand the hazards of this practice.
Okay, it was not safe in a sense that those shafts we teach people about HIV and AIDS, and the shafts are so dangerous. We have a school building around here. Some of these children at times can come here. In our absence, some people might come, go in there and take some out. There are some black beggars around here who may come and take out some of these needles that we had used and try to board them in order to use them.
Today, things are different. As Michael demonstrates, safety boxes are now used to carry all sharps, which are then disposed of in a covered pit. Solid waste is put into the new incinerator, and surgical waste, such as placentas, are covered in an organic ditch. Through the building of such facilities and educating of communities on how to properly use and maintain them, the Liberia Wash Consortium is working to bring sanitation to communities across Liberia, ensuring a safer, healthier future for all.